Welcome to this edition of CEO Corner. I'm Otis Rawl, President and CEO of the South Carolina Chamber of Commerce, and I'm happy to have with us today Thornton Kirby, who holds a similar position at the South Carolina Hospital Association of President and CEO. Thornton, thanks for being here today.
Oh, it's a pleasure. As a member and as a partner, it's always great to be at the Chamber.
Well, I tell you what, it's a tough day and a happy day and a busy day to be in healthcare right now. I know whether you are a provider or whether you're an insurance company or you like us business folks trying to figure out what's going on at the national and state level, and maybe we can talk through some issues today and help our folks understand exactly what's going on out there.
You're exactly right. It is a really volatile time. It's a time of a lot of opportunity. It is a crossroads when our nation has to rethink how we deliver healthcare and what we expect of the healthcare system, and we've got to bring our costs under control for business, for our national security, for all these reasons. You know, I was at the American Hospital Association's annual meeting this past week, heard from a lot of elected officials and commentators, and one thing remains true. You know, Americans really want three things from their healthcare system. They want the best care in the world, they want somebody else to pay for it, and they don't want to change their behavior. And that's what we've got to struggle with. But I'm delighted to be here. I look forward to talking about all these issues.
Well, I think that's one of the issues that we've talked about. It started maybe last year at our annual meeting when Joe Sally started talking about what is the second highest cost usually for businesses other than payroll, and that's health care.
Right. And
providing that fringe. And when you look at health care costs in the United States in comparison to other OECD countries, we're almost 2.5 times the cost there. And I read the question, Thornton, was how do we get there, and what do we have to do to start beginning talking about cost controls within the system? What can businesses do to help? And you know, I think everybody sees hospitals as a place that, you know, they pay bills, but hospitals are also businesses too that incur the same type of cost that every other business incurs when you start talking about healthcare. So it's a double-edged sword for you.
Absolutely, because we have that benefit cost that's a very high component of our overall business structure as well. How did we get here? That's a really great question. I think it has to do with our culture and our expectations. We are an instant gratification society. We expect to have the very best. And we don't want to have to wait for it. So one of the great concerns we have about other nations is the fact that they are not as quick to give everything to a patient because of the way their insurance is set up. But when we make utilization so easy, it drives up our costs. And we also tend to be less healthy than other nations. So we've got to get at several aspects of this, and there's a lot of work right now around what's being called the triple aim for healthcare. There's been a great movement in this country in the last decade to improve quality and safety of patient care, and we've seen some great examples of that. But going forward, we have to work on three different things simultaneously. One is quality of the patient's experience. Did they have a good experience, and did they have the right outcome? Secondly is how have we dealt with population health? Are we getting healthier as a society? And then third is, can we reduce the per capita cost of care? We have to make healthcare costs less per person. For an example, let's say hospitals and doctors can figure out how to cut down the cost of an open heart surgery in half. If we do 2 times as many, we're not going to save any money. So we've got to reduce the population's need for health care, and we've got to reduce the cost each time we encounter it. And that's what our job is, and we understand. I'm really excited because our hospitals and physicians in this state get it. They know they have to get higher quality at less cost in the future, and that's where they're working right now.